at redlining and the impacts of redlining in communities of color, specifically the Black community, but I mean, it's happening now with zoning. And I see it. I see it in the city of Elizabeth. I see it in the city of Newark. And even when contracts are awarded, and when they're talking about, oh, we're going to change the dynamic of this community, so those are the things that really frustrate me. And it's like, yeah, I remember my teacher at Rutgers, he said, the most valuable property is in the center of a city. And the people that own it do not know how valuable it is. But mind you, the moment the group of wealthy white individuals realize that people want to come back, it's going to be taken away from them. And to your point, when you mentioned that's exactly what's happening. I mean, he said that 15 years ago. So it's just, yeah. So I'm like, all these thoughts are coming to my mind. So thank you for that.
Yeah, well, I mean, I have to say, my wife and I just moved to Philadelphia from the suburbs. It's great, but we moved into new construction. We are taking advantage of the tax abatement. And
I have abatement.
and so, you know, I'm in some way I'm benefiting off these policies, and I'm certainly aware of it. And I know that my neighborhood, you know, it's shifting as well from, I mean, I think it's certainly minority, and I don't see that changing anytime soon, but they are working to develop the area that, you know, the city that I'm in, and I know that property values are expected to increase quite a bit, and just so much construction going on, building large retail and residential, mixed use zoning, all that kind of stuff. That's exactly what you're talking about. So at the same time, my wife is an immigrant from Vietnam, and so, you know, she has certainly faced some difficulties in terms of, you know, just dealing with, you know, her family's health back in Vietnam, and she's coming into, you know, the country now, and we're, you know, she's expecting that, you know, this life will be better for her here, and all those kind of things. And I think that's positive, you know, but it's very mixed. And you know, I've seen for a long time just how, you know, writing financial information, you know, tends to miss all of these things, you know, especially disability issues, that prevent people from taking advantage of all the financial advice that's out there. I mean, they say, you know, step one, save 6 months of expenses for your emergency fund. And that's step one, and that's not step one for everyone. And just getting to that point, different situations have all different kinds of obstacles.
Yeah, and I think I kind of want to touch a little bit on, you know, when Courtney said early on, and then kind of what she said last week as well when we were talking about having more money means more personal autonomy and more choices. One of the things that, I mean, I'm an upper middle class white lady, so, but one of the things that really got me thinking about some of this stuff a few years ago was I was in a situation where I had an unplanned pregnancy. I didn't even know I was pregnant. I actually didn't know I could get pregnant because I was on my birth control. And so step one is I had no idea that antibiotics mess with your birth control. So everybody just didn't know that. Brynne can probably relate, but I grew up in a community where that was just not information that was imparted to me. Because this sort of information is based on what state you live in and what school you go to and what communities you're part of. I had no idea. So I was a 37-year-old woman who had no idea. And when I found myself in a doctor's office wondering what the heck is going on here, and the nurse saying, you know, what you're having is a miscarriage, I started thinking about like, okay, well, what if nature hadn't been taking its course, and what if I had to make a choice, right? What if I had to make that decision? And would I be able to do it? and how much is it going to cost me? Because health insurance isn't going to cover it. Medicaid's not going to cover it. Nothing's going to cover it. You're going to have to pay for it yourself. And so I started looking at it, and in my state, it requires, you have to have your initial consult, and it has to be in person. And so in my state, depending on where you live, it might require, like where I lived, it was 2.5 hours to get to the closest place where I could have a consult, the closest Planned Parenthood. So that's 2.5 hours. And then you have your waiting period. And then you have to come back. And you have to pay, and all of the things you have to pay for. You have to pay for the ultrasound, because they're going to make you have an ultrasound. Then they're going to make you look at it. Yep. Then they're going to make you look at it, and then you're going to have another waiting period to think about what you've done. And so, and then you're going to have another waiting period, and then you're going to have to go back again. And so, depending on the state law, it's anywhere between 2 and 3 visits. All of that's going to cost you money. All of it's going to be expensive. There are some states that allow you to do your initial consult by telehealth, so that can cut down on some of the costs. But then how are you going to transport across state lines? So I was lucky enough to be in a position where whatever happened, I could afford it. Whether I had a baby, and that's the next thing, right? What happens? Can you afford the child? Can you afford whatever mental or physical issues that come with that? Can you afford it? So there's a lot of things that go into that we don't talk about. We just sit down and say, oh, it's a political football, or it's this or that. But it affects your finances. And a lot of people aren't going to have that access that they need.
And I think to your point, Pennsylvania has, Southeastern Pennsylvania versus Casey, Southeastern Parenthood versus Casey said that you can do it by trimester.
Yeah.
You can have, but here's the thing, and I think you could appreciate this, like what's going on with my body. A lot of women don't even realize that they're pregnant until the end of the first trimester. So all that waiting period does is add more time, and it sometimes can push you out of the window where you're even able to have an abortion under your state.
Yeah.
And again, so I had a very similar situation. It was 2014. I was working in West Virginia. In West Virginia, I think the only Planned Parenthood that actually would do it was in the southern part of the state. Now, I had autonomy because I was working at a high-paying law firm. I was doing oil and gas work when Marcellus Shale was like the thing. So I had the money, and I had the autonomy, and I knew. Okay, I said, oh, well, maybe I'll go to Pennsylvania. I know this is difficult. I can go right up to Pittsburgh, but Pennsylvania had the 3 days. I was really coming in very short in my time period, and I said, oh my goodness, what can I do? And again, you're also shamed. You're also like, oh my gosh, how did I do this? And then you have a phone call. I had a phone conversation with a friend of mine, and she said, Court, just go to Jersey. Jersey, easy peasy. You can get it done in a day. And I said, but of course, because I had autonomy, I had money, I had resources, I was able to take myself from West Virginia, come home to Philadelphia, take myself to Cherry Hill, and get it done. And interesting enough, my insurance covered it. I don't know what they coded it as. I paid it out of pocket, and then I get a check in the mail. I was like, what's this? This number looks very familiar. I'm just going to put this in my bank account and go about my way. But I think to that point is that, again, all of these restrictions that are placed now really could change the trajectory of someone's family. And again, it's like this policy is that I'm so concerned about what you are doing. And it's like, even from the concept of, hey, we're Christians and we shouldn't do this. And it's like, yeah, but I mean, even the book tells you you have free will. So why are you bothering me? Yeah. So I think it's all of those things about, power and control that really comes across, that really kind of sits very deeply into personal finance. And I don't even think we realize it until you kind of step back, because you're like working every day, to do your personal finances and make sure you get this right. And you're just kind of like, okay. But I mean, even as simple as 401k, I can only put away $20,500. That's it. I mean, now I can put additional money away, in a mega back door. I can put after tax money. I'm all the way capped to $50,000. I mean, 55, 57, 58, somewhere like that. But again, I'm still kind of stopped about what I can do, and it's trying to stop the rich people. But there's other people that would like that opportunity to have a little bit more leeway, and we don't.
Yeah. and I think that goes back to an interesting, we have other questions, but that was a question, you know, you talk about like, oh, we're trying to stop the rich people. Well, are we so, and that brings us back to like maybe the other side, right? We talk a lot about like, you know, well, we should be doing more to help people, we should be more progressive, we should be doing these progressive financial policies, but let's flip it to the other side, and as somebody who's on that other side, one of the things that does kind of get me is the whole means testing. We're so concerned that one rich person will get an extra $1,000 a month, that we can't do it for people who will really need it and really be helped for it, and for whom it's life-changing money. And then, you know, on the flip side of that, of course, also is we're so concerned that an undeserving poor person will, and undeserving, right? Undeserving, that idea of who deserves what. An undeserving poor person will get $5, that we're going to spend $50 to enforce that they don't get that free $5 or that whatever, right? And so I think that's part of our issue as well. We're so concerned, like you said, with what everybody else's business is. Do you deserve this? Do you, you know?
Even before my child was diagnosed, I interfaced with the welfare offices a lot.
Yeah.
I started writing about money and I had absolutely nothing. And it was incredible, the amount of money that they would pour into paying social workers to purposefully try to trip you up. I could submit all of my paperwork to the T. I'm a very analytical type A person. I was on top of my stuff. And then someone doesn't scan in a page accidentally. It happens the first time, you think, oh, it's actually an accident. It starts happening the 5th, 6th, 7th time when you're reapplying for these benefits. And I'm talking about, I was a pregnant lady who needed food. Like, I'm talking about, this was electricity, this was heat to keep my children warm while I worked on building my business, while I worked on going back to school to get my degree. It's not like I was not trying to improve my plight. And we invest a lot through the means testing, but also through the way we actually administer these programs and the way that we treat the poor as if the sin is on them rather than poverty being a societal burden. And it's just really, it's a really frustrating situation to be in. And I think that's why a lot of people have such trouble getting out, because we do invest so much in making sure we punish people for that sin. And that's like a mindset that goes back to like Europe when like pre-colonial Europe, and then when Europeans started colonizing everywhere, they brought that toxic mindset with them. And it's just something that we have to really work hard to really try to eradicate, because it's not healthy and it's not productive for any of us.
So that brings us to this other question. What are some ways, so now when we talk about this, right, like one of the things we all want to do is like, we don't want to get political, right? We don't want to talk about politics. So how can we talk about it in a way that focuses on our outcomes rather than grandstanding and rather than a lot of performance? How are some of those, so let's give us a minute to like think about that for a minute. Because that's a hard one, right?
I have a comment on that. So one thing that someone had shared with me, which is really interesting, when we ask people individually what services, what programs do they want, more often than not, they'll say, I'd like free college education for my kids. I'd love to have free health care. So they'll say these things. And then when we change the question to what policies can we affect in order to help people, all of a sudden they don't see themselves as the one being helped, and they see other people being helped. Therefore, they no longer want those actual benefits that they want themselves. So like, I don't want them to have it, and thereby affecting them. So it's like this mindset thing. And so usually when I'm having conversations with people, I always ask, it's like, what services or what programs would you like to see for yourself that can help you improve your situation? And interestingly enough, these are things that are universal. But then when we start talking about policy, they're actually fighting against what they actually want because of the grandstanding. But then like bringing it back to, let's go back to the initial conversation of what can help you get to where you want to be. And I find that becomes an easier conversation. And then we can start talking about the policies that's in place. But I think we all know this. People tend to vote against their own best interest for whatever reason. And so for me not to get frustrated, not to get angry, because I'm going, what is wrong with you? Like, why aren't you, you know, it's going back to that. Like, what is it that you'd like to see happen for yourself? And then taking it back and looking at the policies that prevent that from happening. And hopefully, I mean, I don't see them changing their mind anytime soon, but just planting that seed. And hopefully someone else has that conversation. It waters and it grows, and, you know, they change their voting to actually vote for policies, vote for those elected officials that are gonna help them.
I think you made a really interesting point about, you know, I want free college education, but it makes it very interesting. We talked about education before, is that do you want free college education because you feel like that's where people actually get educated? And then the question is, by saying we want free college education, are we appreciating that there's a systemic flaw in our K to 12 system? And I think we are, without saying it. So I think the real answer is, because I think even in Philadelphia, is that we've actually taken away our opportunities for trades. I mean, we have a few schools that do it, but we used to have a lot of trade schools, and we actually had a very nice skilled labor force. And people have kind of, I think there was a societal shift, like college is the way, but it's like, is it for everyone? Is it for everyone, and not even a function of, you know, does everybody have the intellectual capacity? So let's say that is the case. Everyone has the intellectual capacity to be a college graduate, college educated, okay. But based on what they're trying to do they need this level of education? And I think that's a conversation that we should have across the board, especially when we're looking at those who are differently able. Because I think we kind of kick them out of the system in terms of educational opportunities, where it's like, hey, what are you good at? And I don't think our educational system really focuses enough on that, but I think that's also a policy decision because we're not funding it properly.
That's interesting, because when it goes, my brother he's a behavioral psychologist, and he deals specifically with teens with autism, and he works specifically with those with Medicare and Medicaid, and not the private insurers, because he sees how there are very little programs and services for those who need it the most. And he sees companies and organizations that work with kids with autism switch to private insurance because they make more money. And so it's sort of like, then, like, we had a conversation, we go, okay, well, the policies have to change where they have to be in line, like paying these organizations in order to address this need. And so that's one of the things that he's frustrated with, because he's passionate, he doesn't see his strategy changing anytime soon. They're growing, but he's unable to pay the behavioral analyst competitive rates because of the fact that the government doesn't pay competitively based on private insurance. And then it becomes like this big circle, and so...
I'm so excited you brought this up. So like, this is a huge problem during the pandemic, because here in Pennsylvania, we're actually really lucky, at least for kids under 21. Regardless of familial income, we get access to Medicaid. Even if you have private insurance, Medicaid becomes the payer of last resort. So there's a lot more behavioral therapists and stuff like that. Not necessarily dentists. Dentists are their own breed, but like they will take Medicaid because everybody has it, because everybody qualifies, and it's a very positive thing, and it's a part of the reason I haven't moved. Like, I'm not in love with Pittsburgh, but I have access to medical care there. And during the pandemic, that's been a huge thing, is that at first there were like the initial layoffs, because the behavioral therapists a lot of times would go into your home to work with the child, right? So there were the layoffs, and then people were like, wait, why am I not freelancing? Like, because like the state only pays so much, right? The private insurance is paying part, the state's picking up the rest of the bill, but at the end of the day, how much I get paid is capped by policy. And how, like, if I can go out there and freelance and work with like the families who have more money to fund these services out of pocket, why am I not doing that? Like, I need to make money too. This isn't like, I love the kids, but like I can't be a charity and still take care of my own personal finances, right? And so we've actually had huge staffing shortages, and here in the state of Pennsylvania, the wait lists to get back onto services are, I've been on the wait list for like over a year and a half now to get back onto services, because there's nobody left to staff because of that exact problem. Like, it's crazy. It's crazy.
So I think one of the things I'm kind of hearing out of this is, and that we've talked about throughout this, is one of the things we haven't really had a conversation about as a country or even in our communities is what are our priorities and what kind of society do we want to look like? And we don't really talk about that. And what would it take to make that happen, right? There's that famous thing, nobody asks how we're gonna pay for it when we're going to war. Nobody asks how we're gonna pay for it when we're off killing somebody in the global south. But we haven't stepped back and said, well, wait a minute, let's not just talk about how do we pay for it. Let's take a step back and start with, we always talk about this in our personal finance, right? Like, let's start with the why. Let's start with what we want things to look like. What do we want our lives to look like? And retirements, right? What do we want our country to look like? What do we want our society to look like? And I think one of the things we're not doing is talking about that, you know, and so then I guess the next question is, where do we start? Like, how do you do that in your community? So what are some ways you can do that in your community to start these conversations? So that's something you can think about to take back to your own community, right? Like starting local, right? So much of our focus is, oh, well, you know, let's just talk about the president and he should magic everything better. Well, that's not how it works, right? One of the things that Courtney said earlier was, like, we're people, like, you know, and the government is made up of people and it's meant to serve the people. So how do we as people start doing that?
Yeah, I think it's interesting, right? Because when we think about, like, we're going to change the country by electing a president and it's going to trickle down, when we know, like, grassroots wise, like, the policies that affect us the most are the ones that our councilmen pass, the zoning and our mayor, and then the county level and the state level. And I know for sure, I guess I always look at the bigger picture, the national picture, and I go, that's important. But then looking at and not picking a political party, their strategy has been work the local level and really move through the local level, and then you see the changes within local government, state government, and then in the national level. And there is, so I think too, it's school boards are a big thing as well. So it's that really understanding. I think having the conversations with our elected officials locally, the school boards, the councilmen, our council people, the freeholders, or I think they're called commissioners in other. In Jersey, it's like So it's just having these conversations, because I think, because I see it too, like I see it on social media and I see it in conversations and barbecues. We're all talking about the national level debates, but then what hits home is our property taxes. It's our state income taxes. It's the services in the state that we don't receive, or that our garbage hasn't been picked up, and which is an issue with my brother in Cherry Hill. Their garbage isn't being picked up because people are getting sick. They're unable to staff actual people to pick up the garbage. So it's been 3 weeks since garbage has been picked up. Wow. So it's like, those are the things that I think we, like, having these conversations and having the channel to communicate with them, for me has been really important. And the work that I've done just in Elizabeth and in Union County, and understanding, you know, whichever side you're on, it's like talking to a brick wall at times. But I guess just having those conversations and really opening them up in many ways. I feel at times too, when I talk about the importance of personal finance, when I talk about the importance of certain policies that affect our money, it's like, I'm working as a free lobbyist, because obviously there are small little lobbyists locally that are doing this to them, allowing to pass certain laws and certain zoning stuff. So yeah, I think that approach would be the best in my mind.
I think also understand how things work. I think there's a really fundamental disconnect about how things work. Like, who actually makes your policy decisions on your local level? I mean, I know we just had a local election. What were you voting for this time? State representatives in Pennsylvania. I'm trying to think of who else we were voting for. We had a primaries for I think state level. Yeah. But I say that to say, a lot of people, we had the lowest turnout. And it was like, okay, but these are the people that are coming up with the rules and regulations that, like, affect your day to day. I mean, the federal government, it takes about, 4 years, I would say, for a new law to kind of trickle down and affect your day to day. and depending on whatever that federal law is. I mean, so I think people understanding like, hey, you know, I have a problem with the way crime is managed in my city. I mean, Philadelphia has we have a really big crime problem right now. It's devastating. And we have, to your point about people not going to work, we have police officers who are like, you know, I'm okay with this. But then also we have a DA who doesn't want to enforce crime. I mean, it's like, that's your job. So, I mean, and there's also, you know, legislation that they're trying to remove him right now. So there's that too. But again, I think, but people don't quite understand that. But then also Philadelphia had a very serious problem with the DA I don't even say over enforcing, he's just making stuff up. So, I mean, so again, people are just kind of feel like, hey, this is just happening to me. It's like, no, this person, if you know they're making it, vote them out. Vote, but you're not showing up to the election because you don't know how things work. And I think we don't even have civics. I mean, when I went to civics in high school, we just talked about the federal level. We didn't talk about local stuff. Yeah. And I think that sometimes I feel like, I don't want to say that there's a conspiracy, but it's just like, well, why are we not talking about local things if you're educating the next group of voters? But I think sometimes it's just easier not to tell people so they don't know. I mean, even with birth control, like you don't know unless somebody tells you. Like the NuvaRing ring doesn't work if you weigh over 175 pounds. People find that out the hard way.
Well, that's the other thing too. It's like when I went and got my prescription for my antibiotics, when I was at the doctor, all of those things. There were many levels of people to be like, just remember, this is a thing.
Right.
Nobody. The pharmacist, no. The doctor, no. My mom sure didn't tell me anything. But I think another interesting thing that goes back to how personal finances affect our ability to interact is how do you find that time to get educated, to be involved when you are working 2 jobs and you got to get the kids their homework done and you got to get, you know, little Jimmy to soccer practice and, you know, like how do you manage that and how do you have time for that? And so I think those are things that go back to what kind of society do we want to live in and what kind of priorities do we want to have.
Even if you have knowledge, getting to the polls on Tuesday.
Right.
Yeah. If you're working 2 jobs, and I saw that too a lot in Elizabeth, where both parents are working, and kids are online learning, and they're having issues, and now they're back to school, and that's one of the biggest issues in the district is the one, just participation and their behavior. And that has a lot to do with, well, yeah, when you go to wealthier districts, the parents were able to work from home. Now, some of them hired tutors and they had the equipment. We had people in Elizabeth who didn't have access to Wi-Fi, so there were kids at outside of like Dunkin' Donuts getting Wi-Fi. And then the city decided we need to change the policy of the board, and they got iPads for everyone, and they figure out where to get it because they realized if you're gonna serve everyone, and it wasn't about equally, it was equity. Like, how do you ensure that everyone gets the tools that they needed? And so I've seen that, and I've had conversations. So I'm a board member for the Urban League of Union County. And so a lot of the work that we're doing is ensuring equity, ensuring like the resources that are available to reach the individuals that are in need. And so like hearing the stories of parents who are working and they had to work through the pandemic, and then now their kids after 2 years are suffering. And also like the kids who are differently abled and they have certain health issues, yeah, well, the parents are working. They can't get out of work in order to talk to the administrators to get the services that they are kind of like law requires them to receive. And so they're coming in, they're frustrated. Like, we don't know the laws, and so they're like, we can't leave work because we need to earn that income, and then we can't get the services for our child, and then it's this issue. And so I like your point where. And I don't think we see enough of elected officials talking about that grander, bigger picture of like, who do we want to become as a country? Who do we want to be as a society? And I don't think we have then that why, right, in personal finance. And then, okay, what does that look like? Is it free healthcare? Is it education where we're gonna assess K through 12 and talk about trades and things like that? I think that is a really important thing, and I think I'm going to go back and have that conversation. I think we need to press our local officials to say, I get the policies, I get what you stand for on the national level, but locally, what's your vision? What's your vision for our community? And I think that's what my takeaway is from this.
So we're pushing up against 8 o'clock, but does anybody have anything else they'd like to contribute? Or?
One of the questions I always have is how, and I talk from the perspective of within the personal finance content creator community. So bloggers who talk about their experiences with money and often as a result are seen as giving advice about what their readers should read or what their readers should do or their listeners if they have a podcast. How can we shift the conversation so that there's more of a realization of the obstacles that people have, and not that you can pull yourself up from your bootstraps, but there are often systemic issues that stand in the way of just the basic personal finance advice that's out there.
What I try to do in my work is, I have a limited experience, right? Like, yeah, I have a disabled kid. Like, yeah, I spent some time in poverty. But, like, I'm also dripping in privilege. Like, any room I walk into, I'm automatically dripping in privilege. And so there's only so much I can write about and only so much perspective I can provide. And so for me, especially through the pandemic, I've really tried to like ramp it up through the pandemic. I used to have guest posts from people writing about different topics and different strategies they've used to apply to their life and their personal finances. But during the pandemic, I assigned a budget to that. And I started, because I had money, so I was like, okay, I'm gonna pay people now because I have it. And also connecting people with editors. Like, okay, this is a story, I think it's really cool. I would love to like pitch this to an editor, but you know what, I don't have the perspective. I don't necessarily know all the nuances of this situation. So I think like a lot of addressing that issue of like, how do we get outside of our own little silo and outside of our own little influence, is that as we're writing, as we're influencing or whatever, as we're having podcast episodes, bringing other people in to share that lived experience and that perspective, because that's another thing I see a lot in personal finance is people will advocate for certain policies thinking they're doing a really sweet, nice, good thing. But really the policy that they're advocating for is just adding further oppression and further struggle for the group that they're trying to help. So I think just bringing in as many people as you can to collaborate with you and bringing in the people who have the lived experience.
So I think you make a good point about advice. So one of the bigger problems is that if you are licensed with a stockbroker's license, I don't know, whatever the other legal, the 66, 65, 63, whatever that covers, you're not able to speak in public about the things that you know, like literally know. And I think that also hurts people because you're not able to have those conversations that you can. So in terms of numbers, I want to say there's 3% of financial advisors are African American. I think that might be a high number. So you have a very small group of people that are even able to have a conversation at the table. Because to your point is that a lot of people advocate and speak from their own personal lived experience. And I've had this problem online a lot. I'm like, that's just wrong. You're wrong. And they're like, well, how do you? I'm like, well, let me walk you through the tax code. Let me walk you through, these things. And like, not see me do it. No, but again, it's a big deal because those who have the experience aren't able to share it. And so somebody else can get amplified because they don't have the licenses, they don't have the responsibility, but they don't have the full picture either. So I think that some of the policy changes is sometimes changing the laws about what we're able to say, because again, I can give advice, I can give financial advice as an attorney in the context of that person being my client. So that's which I think is uber dangerous because I've seen some attorneys count. I'm just like, oh my gosh. But again, I can do that, but then should I do it? And I think that those are who we allow to do what. And then also you have to be sponsored to get those licenses. So who are we sponsoring? We're sponsoring people that predominantly look like us. We see that by the numbers. The exams are super hard to pass. The failure rate is super high because they're standardized tests that we've seen before. Right. And it's like it's an ongoing cycle. It's awful. So I think changing the laws and the policy about what we allow to be said and who we allow to say it really would change the trajectory of a lot of communities, because they have people who have a broader experience who could actually advocate properly for the things that are really important.
Like if you could get on there and just really go, that would be amazing.
I think one of my biggest things too, when I was really active on doing events, was ensuring that the stage was shared with different people with different backgrounds and different lived experiences. That was important for me because, again, we do have different experiences, but also I wanted to make sure that they had a type of platform and they were sharing information that was knowledgeable. And I learned early on that, you know, to your point, there are people who are elevated within social media and within the blogosphere world. And some of the things that they say, I am just like appalled. And some of the things that, and there's
Look at that taste, right?
yeah, and then there's a double down because people who are uninformed start liking it, sharing it, and then it's like fighting against that.
It's a snowball.
It's a snowball effect. And so, like, to your point, Brent, it's like, how do we continue to like elevate and to ensure like these voices and these lived experiences are shared? And so again, too, just going back in terms of like takeaway as I continue on my mission on the financial education front, is that how do we have more of these conversations? How do we ensure that different voices, different experiences, and professionals have the opportunity to share? I know many who are in the financial space who have these licenses who've decided to let them go in order to combat the misinformation that's happening specifically on TikTok and on Instagram. And you know, their heart is in the right place, but because of the laws and the policies in place, they're unable to truly make a mark. And so there is some catch up when it comes to that. And so going back to the policy aspect of it, and I think that needs to be looked at and evaluated. And there's just something about people who are being able, especially knowledgeable and licensed people, whether they were post-licensed, being able to freely speak the language of the community that they're reaching is essential, because the other side are those who don't have the knowledge, and all they're trying to do is get your dollars into their pocket. And so, but there's no restriction in that, and I think that's something that we need to look at and do our part in.
Awesome. All right. Well, thanks everybody for coming out.
Thank you for having us.
So thank you too so much.